Amputations, we got two types. We got completely off and we got partial. Let's do partial first. Partial amputation. So let's say you got a finger. You got a fingy. Fingy's been cut off. Finger. If it's just partially amputated, dangling a bit, bring it back in line so that it's not amputated-ish anymore. Bandage in place to the hospital. That's basically it. Treat it like any other wound. Direct pressure rest, bandage in place, and we're good to go. If there's dirt around it, wipe away from as best you can, but don't take the thing off. You don't need to make it a complete amputation. Complete amputations, things fully off. Let's separate these. The end that has been amputated. Don't flush this with water. Do not flush away connective tissue. If you wash this, that thing is never getting reattached. So wrap in place, deal with blood, dressing, bandage, you're good. With the part, really important thing to remember. When stuff has left you, this could be an amputated part, this could be organs coming out, this could be an eyeball, could be whatever. If it dries, it dies. If you let this thing dry out, the thing is going to die and you ain't getting it back attached to you. So we're going to have to use some sort of moisture here to fix this problem. Take some sort of sterile dressing. Make sure it's sterile for this stuff, ideally. Standard gauze works well. Moisten this thing inside of that, completely wrap. If it's a finger, for example, this could be the finger wrapped in moist dressing. Put this in a plastic bag. Put on the side for now. Prepare another plastic bag. At the bottom of the bag, you can have ice. So put ice in bag or some sort of cold something in that bag. Put the first plastic bag with the part, so bag with part, in second bag with ice to keep cool. So you've got the one bag with moisture, the second bag with the cooling. Do not put the ice directly on the part. You put the ice directly on the part, you can have connective tissue damage. Once again, you want this thing to be possibly reattached. If you want to make sure that a part doesn't get reattached, take the thumb that's been disconnected and put it under the tap. You will wash away the connective tissue, that thing is not getting reattached. Okay, that will work, as in work in making it not get reattached. So once again, part, moist gauze, in bag, bag in another bag that has ice. That's the basic idea. Also, just to help them out at the hospital, you can write stuff on the bag. Here's the sorts of things you should ideally write. The person's name, the time it was amputated, what part it is. I'm going to tell you a story. So you go to the hospital. This has happened more often than most people want to admit in the medical system. You go to a hospital. You go to emergency because you're a patient and you need to be taken care of because you're in shock because your arm has been amputated or something, your finger's been amputated. Okay. The part goes to a different part of the hospital to assess parts for reattachment. They're not treating you the same way they're treating your part. These are two different specializations. One's a surgical issue, another is a person is bleeding issue, right? You go to different parts of the hospital. You are now separated from your part in a medical system. Oh no. This is a problem. So there have been cases where someone has had somebody else's part reattached to them and they got them mixed up. There have been people who have had, the index finger cut off and they now have two middle fingers. People have had parts attached to them that were from a different person where their skin tone was completely different and then it changed over time. All sorts of fun things have happened. The reason why we have studies showing what happens when all these parts change and all this is because, well, it's happened where we can observe these phenomenon. I wonder how that has occurred. There's been some cases where that's been kind of planned with people who've been deceased with organ donation and stuff like that, but these things happen. So if your name is on the bag, then we know which casualty or patient to connect it to in the hospital, casualty and first aid patient in the hospital. If the time is on the bag, then there's no, okay, so how much decay has occurred? How likely is it that this thing can be reattached? That's very useful. And if the part is on, then if there's multiple, well, then we don't get mixed up. I'm gonna tell you a little secret here. When something's been detached from you for a while, and it's been kind of like shriveling up in a bag in some moisture for a while, stuff just starts to look like other stuff. You don't know what the thing really is half the time. And, it's like, is this the finger? Is it a different appendage? I don't know. So you have no idea. You have no idea what the thing looks like. Who knows? It shrivels up. Who knows? Okay. So Just write the thing on the thing, and then you don't have a thing.